My name is Melissa Williams, and I am the Director of Grassroots Advocacy and Community Partnerships here at National Patient Advocate Foundation. And I'm really excited about this 1 hour that we have together. My team has been hard at work putting some really practical resources for all of you to take out into your communities. And so we're really excited to unveil them today. I just want to set the stage though before I turn it over to my colleague Anita, who's really going to go in and break down what we're talking about when we talk about needs navigation. But for so many of you who either have been with NPAF for the last, I don't know, several years, I think the last 4 or 5 years or so, you've heard us talk about needs navigation. And if you're new to us and just joined this year or the last 2 years, you still heard us talk about needs navigation. Needs navigation is the issue that is the most important one to us right now. And we're going to talk about what we mean when we say needs navigation, why we want it accessible in all care settings. And we invite you to share a little bit about your experiences having either access to it or wishing you had it. And so we're really excited to dig in. But before we do that, I just want to invite all of you, and you all may be doing this already, just to introduce yourselves in the chat. Please let us know your name, where you're joining us from, what you hope to take away from today's webinar. And just a couple housekeeping items. I think so many of us are used to seeing these housekeeping if you've been a part of Zoom meetings for some time, but we just ask that you please mute your lines. We invite you to turn your cameras on. There's absolutely no need for you to do that, but it's always fun to see faces. And then, of course, just enter any questions that you may have into the chat. So with that, I'm going to turn it over to my colleague, Anita. So Anita, go ahead and take it away.
Thank you, and hello, everyone. Thank you so much for joining us today and taking the time out of your day. I'm Anita Reynolds, the Manager of Grassroots Advocacy and Community Partnerships at National Patient Advocate Foundation. And we're hosting today's webinar because, like Melissa said, we're focused on making needs navigation accessible in all care settings. But what is it? Who provides it? And where does it currently happen? And in today's webinar, we're going to provide you what you need so you can confidently tell people in your community what needs navigation is, why it's important, and why caregivers and patients and families need it and make it accessible to their community. Throughout this webinar, we're going to be asking a couple of questions, so we encourage all of you to share your answers in the chat. We really want as many participants as possible so that we can get your insights and experiences and what are making these conversations meaningful. So don't be shy and please add in the chat. Over the past year, our webinars have helped shape the conversation on needs navigation. From our policy consortium, we brought national stakeholders together, which helped align our priorities and policy solutions. At our most recent roundtable, we brought in navigators, community health workers, clinicians, our volunteers. We all shared our real world challenges and best practices, just like Bruce did. And with the Patient Insight Institute, we gained data from patients, the caregivers, and their families on the barriers they face and the value of needs navigation services. So combined, those efforts laid the groundwork of today's discussion. Oh, one moment. One of the biggest themes we've heard, and the data confirms, is that maneuvering through the healthcare system is confusing, complex, and costly. In fact, Patient Insight Institute's 2025 national survey, which included 2,500 participants, we were able to see that it was a widespread challenge. 82% experienced financial difficulties in the past year, and 77% of those patients identified financial distress as their top worry in healthcare. In fact, it ranked above the possibility of dying. Now that we've looked at the challenges the patients and caregivers face and seen the data highlighted, how complex and costly navigating the system be, we're going to ask a key question. What is needs navigation and how can it help address these challenges? And in the next session, we're going to define it and show you why it matters for patients, the caregivers, the families, and all the communities, really. So needs navigation is a simple patient and caregiver tested term that resonates because it's easy to understand. It provides hands-on support to help families access the resources to ease the medical cost concerns and also connect with programs to make them more manageable. So the baseline is that it's practical support to get the right care and the resources when they're needed the most. Even when you look at the word need, we need housing, we need food, we need transportation. I need a caretaker for my children. So these aren't, I would like to have, these are the essential resources that we need. And even the word on navigation, um, our caretakers need navigation to help us through the safety net programs and how to get there. But it's also important to highlight what it isn't as well. And so to clarify what really needs navigation is and what it means, we're going to have to look at what it should be and what it does provide. So it's not only for those in crisis. In fact, it's anyone facing barriers in care or services. It's more than just giving someone a list of resources. What it does, it involves hands-on guidance, and it's not a handout. It's not something you get a printout and it's a checklist that we sometimes get, and it's incredibly frustrating. It's not a replacement for medical care and treatment. Needs navigation supports access, but does not provide the clinical services. It's not limited to one type of need. It addresses a range of essential needs, not just the medical bills. Because let's face it, when you think my most common need is how I'm going to pay my rent, and then you're going to think of, okay, my rent is paid, but what about my food? What about my light and everything else? It's not a quick one-time transaction. It's actually an ongoing process that should help people navigate the barriers over time. Because when we get sick or anything were to happen, your treatment is ongoing. These barriers can come and go, and it's not only just a one-time thing help. And it's also not only focused on one group. It's not just for patients, it's for the patients, the caregivers, the families, and also even the navigators themselves. Because sometimes even so many of us are in the room, we need the help to navigate as well. So I want us to take a moment to think about your own communities. If someone needed help paying food, mortgage, rent, utilities, where would they turn to for the support? Let's take a moment, and if you'd like to share in the chat, that'd be really helpful because this will help us start thinking about the real world resources people rely on and where the needs navigation can make a difference. Now that we've talked about what needs navigation is, you may be wondering where can people actually find it? In healthcare settings like hospital and clinics, needs navigators and navigation itself is often focused on helping patients get referrals for health insurance and access care that they need. Just even by a show of hands, how many people have known someone or even themselves have gone to an emergency room and they didn't have health insurance? And, a needs navigator helped them either qualify for Medicaid or even a financial support program through the hospital, or even have you help someone do that. In a community setting, like a health center, food banks, even the libraries, the navigators help connect people to a range of essential safety net programs like SNAP, Medicaid, or others. And even another show of hands, how many times, or have you looked last time you were at a public library and you saw resources to local community banks, food banks, to diaper drives? And also needs navigation is not limited to clinics and community centers. In some areas, it can be found in schools, churches, even barbershops and laundromats. And in these spaces, the navigators act as hubs, sharing the information, educating the people and the public, and raising awareness about the health and social services available as resources. And again, just quick show of hands. Um, when's the last time you, and we all do this, if you're at a barbershop or at a salon and you're sharing, you start talking like, oh, I got this help in this community, or did you see the next health fair that's happening? They're going to be doing free mammograms, free cancer screenings, checking blood pressure. So when you think about the different settings, many, many times it's not a very formal setting, it's informal as well. Now, while needs navigation exists in many places, not every community has access. There are barriers included limited funding and staffing, lack of awareness, transportation or technology, challenges such as the complex healthcare system and cultural and language differences. But these challenges highlight why expanding and strengthening needs navigation is so important. And I know so many of us in this room got to NPAF by accident or someone navigate them or like just word of mouth. And how many of us have said or have been in webinars or learned about even being able to get a patient advocate and you wish you knew that before. Now that we talked about some of the common barriers to accessing needs navigation, I wanted to bring it a closer look to home. And I would like for y'all to think about your community again and what makes it difficult for the people, patients, the caregivers, and families to get the support they need. Would love it if you guys can share in the chat. Are there any gaps in awareness, transportation or staffing issues, cultural language differences? It could be, are there maybe systems themselves are too complicated to navigate? And then I also would like to share, even for me personally, in the area that I live in, when I discuss about needs navigation, they kind of get it. And then I ask my community, when was the last time you saw a bus stop? And then we start thinking of like, oh, where are there bus stops in our community? And then we have that conversation of then think about if you didn't have transportation get to your care, how do you get to your doctor's office?
Anita, I'm just going to jump in to acknowledge some of the answers to the question in terms of the barriers that people are experiencing.
Okay.
Some people are sharing that, it's fragmented, the systems are siloed, there's a lot of bureaucracy. People are not knowing that even help exists. And if they do, they don't know that, you can seek help. And people have acknowledged that it's just even hard for them to ask for help and that families are overwhelmed. And so I think that really hits on a lot of the barriers. And I think that's something for us to be thinking about when it comes to, raising awareness about needs navigation. We also have to acknowledge like it's okay to ask for help and that there are people who are available. So I just wanted to acknowledge the responses because there's some really great discussion happening in the chat.
Thank you so much, Melissa. I can't see the chat when I'm sharing my screen, so thank you so much. So here we're gonna notice that people who provide needs navigation might go by different titles, and you might see your title on here. So from care coordinators, patient advocates, social workers, even though the titles vary, the goal is the same, to provide hands-on support and connecting the people to the resources they need. So I want to take another moment to look at our own communities. And has anyone you know, or even a healthcare staff worker, ever been confused about who to turn to for help? And maybe they didn't know which office to call, which program could assist, or how to get the right support quickly. And unfortunately, this is a common challenge, and it really highlights why clear, accessible needs navigation is so important. And once again, I would love it if you guys can all share in the chat. And Melissa, if you see anything, we can call out as well. That would be great. I knew for me personally, when I tell someone about getting a case manager, one common theme has been, well, the case manager at the local hospital didn't really get the needs I needed without realizing they have their limitations, and it's not a bad thing regarding limitation. And we're going to go into the next slide, which will share a little bit about that. Now, you may notice that the programs and services sound familiar, but they don't always do the same thing. And even the different organizations might sound alike. So navigation or patient support, like I said, they all have the same goal, but even where they work might be different. So we
Okay.
created this chart based on our understanding of the different types of navigation and the role of these navigators play across various settings, as well as stories shared from the volunteers and advocates. If you look at the term of case manager, it can be used our own case managers at Patient Advocate Foundation or a case manager at a hospital. But the responsibilities they represent can really depend on the setting of where they work. And so if you look at this chart, I would also like to know, does this reflect what you've seen from your own experience or even your own work? And I would really love it as well if you can share any insights and roles that we can include as well. This isn't a final, it was a start.
And Anita, I just want to jump in again because there is a lot
Perfect.
of great discussion. If you just go back to the previous slide, I think the last thought exercise you had put
Right
about
here.
being confused. Yeah, I think there was discussion around people are directed to the wrong places. And so, and how just time consuming it is to put into like where do I need to go? Who can I talk to? And that, the training may not be there as well. So I'm trying to keep up with that discussion, but I think this comment here, some systems aren't responsive or the navigation is so overwhelming that families give up. And I think we have some great discussion about like no wrong door policies, and just really trying to make sure that people get connected to the help that they're looking for. Um, so I'll let you continue and try to keep tabs of some of the other elements of the discussion that's happening.
Perfect. Thank you. And I was actually just able to move the chat around so I can now see them too. Thank you so much. Now, I also another personal story when you need to call someone, a community health clinic. I was getting resources for my husband's unit and even getting a call back. That alone, I had to call, I think, 4 times. So NPAF's mission is to make healthcare work for all of us. So that's why needs navigation is a key part of that mission because it helps connect people to the resources that truly affect their health, like the food, the housing, mental health care, insurance assistance, and caregiver support. And by addressing these essential needs, the navigators help ensure that people can stay healthy and get the care they need. We looked at the data from Patient Insight Institute earlier to understand how patients view needs navigation. And when asked about the availability of it, patients consistently ranked it as a top priority for improving their care. And this underscores the real impact these services have on people's life. Patients don't just value medical care, they want the support that addresses all the factors affecting their health. The process of advancing any type of policy change happens in stages and phases. So the first, we're to raise awareness, where we highlight the importance of needs navigation by sharing stories, collecting data and experiences so people understand the value. Next, as the setting the standards, where we work to define consistent practice guidelines so navigators across different settings can provide reliable, high quality support. And finally, it's scaling. Well, we'll focus on expanding access so that all patients, caregivers, and families, regardless of where they live, can benefit from these services. And each of these stages builds on the last, ensuring that needs navigation moves from concept to widespread, impactful solution through communities. Now that we've explored what needs navigation is and why it matters, here's how you can take action. So the first act is signing our petition to make needs navigation a standard of care. By adding your voice, you're helping raise awareness, influence decision makers, and ensure that needs navigation services reach more people in your community. Our petition has all the information you need, and what it is like a pledge. How many of us have done Boy Scouts or Girl Scouts and you have a pledge? And what that pledge is that you believe it needs navigation. You believe that it should be part of our communities. You believe it's a standard of care. And you also believe that policy should be changed, or at least have that conversation to bring these policies to make it possible. Another way to support this movement is by following us on our social media like LinkedIn, Blue Sky, Instagram, and Facebook. And if you haven't already, you can visit our website, sign up for those updates. And then if you find our resources helpful, even this webinar, please share it. We would love it if you see on your Facebook or on Reddit, if any of you are on those threads and you see, or I've even seen it where like someone says, I wish there was someone that can help me navigate this. You can comment about needs navigation and share resources and how to ask for it. And if your community doesn't have it, what can we do to make sure that it is part of your community? Now it's time to take what we learned today and connect with your community, because real change happens with conversations. You can use today's insights to spark these conversations and discussion, whether it's at a dinner table, at church, a next PTA meeting. You can help others understand what needs navigation is and how it can strengthen our community. Because remember, every conversation raises awareness and it brings us one step closer to making a bigger impact. Our next step is to share your needs navigation stories. We would love it if we can put a face, an experience, and help decision makers and community leaders understand how access to needs navigation impacts real lives, and your experience can make a difference. So we would love it if you would share that story. Encourage others to speak up. So as you're sharing to your community what needs navigation is and how great it would be that just becomes standard, encourage them to also share their experiences, your family, your neighbors, spreading the word. You can post it on your social media. We will have a QR link where you could share your story. We would love it if you can just have it on your phone, take a screenshot so that when you speak to someone, you can just show it to them. And to help you take all of these actions, from sharing your story to spreading the word, we're excited to share with you our newly created Needs Navigation Toolkit. You can access the Needs Navigation Toolkit by visiting our website and signing up to download your copy. There's a couple of pages here. We can look at some of the resources included in the toolkit. You'll find we'll have one-pagers with social media posts, fact sheets, guides, and other tools. And these were specifically designed to help you share the information, raise awareness, and engage in your community. And each resource is ready to use, making it easier for you to take the action in your own community. So next week, we are having our office hours. It's hosted by my colleague, Shonda. And in this next week's office hours, we're going to actually go through the toolkit and go through practical scenarios. We can discuss each one and say like, oh, if you're at a coffee shop, when you're getting your hair done, you're waiting in line anyway, or if you're joining a meeting, a PTA meeting, discussing it, how even needs navigation is done at your children's school. So I'd like to thank all of you for joining us. And here's a QR code where you can easily download our toolkit. You will get it immediately, and then you'll also get an email sent to you as well. Thank you.
And I think, Anita, at this time, we're going to open up for Q&A
Yes,
and discussion. So I think we'll leave this slide up for just a bit, but we have a lot of great points and discussion in the chat. I tried to flag some questions, but I think we can also give an opportunity for others if they want to come off mute to ask their question. But the questions that I had that I flagged. One was, how are you addressing the current administration's cut to all safety nets that are sponsored by the federal government? And I'm trying to note who asked that question. It's way up in the chat, but if you wouldn't mind coming off mute, if there's something more that you wanted to add to that, and I'm happy to help answer that question. All right, I will just go ahead and
Hi, I'm sorry, it's me.
oh, there it is.
I'm
Okay, go
very
ahead.
sorry.
Oh,
I really think my age is showing through right now because I'm like, I can't find the right button. I'm Michelle Roberts. Thank you. I did ask that question. Um, Part of my concern about that is several fold. As a patient right now, I'm forced back into navigating for my care with my husband, who is my caregiver for metastatic cancer. That's hard enough as it is. And I can say, as a social worker, I got an MS in social work, and I'm very well aware that there are people who have greater needs than I do. So, my biggest question is that in every community, whether it's a county, a city, a state, hospital systems operate differently. So if you were forced into a hospital system or even a community setting, they all work differently with patients. And sometimes what I found, not at all. It depends on who's responsible for providing patient navigation, if it's even there. If it's not formally there, then it's kind of up for grabs. You may get a receptionist who really doesn't know how to handle a complex question about your care, a test result, or when you should do what. My biggest concern right now, as the social worker element, is when you have people living in disparate communities who have been depending upon SNAP, who have been depending upon Medicaid, Medicare, even, who may have SSI, Social Security insurance, and now they don't. What are we going to do to tell them where to go for help? My biggest frustration, just as a common person who tries to help her neighbor, is when someone says to me, I just lost my SNAP. What do I do? Food banks are empty now. And that is the truth, at least in the Baltimore area. People are struggling. And I know that's everywhere. What do you suggest we do now to mobilize? Because this is a different world right now. And as much as I'd love to say it's going to get better, I'm feeling pretty negative about it.
I thank you so much for chiming in, and I think you're not alone in feeling that way. I think by a show of hands, there may be a lot of other folks who feel the same way as you do, and that's why they're here. And you're absolutely right. How can we? It would be great to have exactly what we're talking about, needs navigation in all care settings, so that people have a guide to take them to and through whatever barrier or issue that they're experiencing. But what you're bringing up about, you know, the programs that exist to help those situations, they're at risk right now as well. And yes, I think it's so important for us to be talking about that, to be acknowledging that and acknowledge and supporting those organizations, those entities that are providing those services, really lifting up like these are the programs that need help. Because they are not, if they don't exist, then so many people are just going to fall through the cracks. And I think it starts with having those kinds of conversations and starting to really lift up, where do they exist in your communities?
Mhm.
And I think there's like a really important exercise that maybe we can start to think about in terms of like resource mapping. I think someone had dropped a link in New Jersey. Is it Family Voices New Jersey? If I think, Lauren, I see you nodding your head. Did you drop that link?
Yes, I did.
And could you say a little bit more about how that came about? Because it would be sort of great to have other communities maybe emulate something like that you've created? Or
Yeah,
not, or
I didn't.
that's there.
We didn't. The government did, but basically, NJ Helps is an online version of 211. But what it does is you key in your information, like your finances, your family size, that kind of thing, and it will say you are eligible for this, 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 and this. And it will link you to the actual application, like SNAP, like LI Heap, like all of the other benefits that people can get.
I'm sorry, I do have a question about that, Lauren, on a couple of points, respectfully. So I think there are a lot of people right now who are afraid to put any personally identifiable information into a system. And
Exactly.
B, the benefits that they're being told are available are not available. That's what's come back to me.
Yes, I was helping a family with a Medicaid appeal, and our three top legal places that folks with disabilities go for Medicaid appeals, Legal Services in New Jersey, Disability Rights New Jersey, Community Health Law Project, all had funding cuts. So they're not sure they can take the case. And we also had Volunteer Lawyers for Justice just drop out of our children's education program. So now when kids have special ed appeals, there's nobody. So yeah, I mean it's getting worse. We started getting calls on economic resources, so we developed a fact sheet on what's out there in New Jersey to distribute to families. But I absolutely agree. People are extremely fearful. I'm bilingual in Spanish. We're getting calls all the time from parents. What do I do with my child if I'm detained? We developed fact sheets on that. I put in the chat, a mom whose child was in a children's hospital and she was afraid to visit. People are afraid to send their kids to school. So yeah, the fear is real and the lack of resources is only getting worse. I absolutely agree.
Okay. Thank you.
And thank you, Michelle, and to Lauren for chiming in there. Lisa, we see your hand.
Yeah, hi. How you guys doing? Lauren, I live in New Jersey as well. And as a patient, I can tell you the resources that you're asking, that you're informing us about, we as a patient, we don't get that. I've asked for it. I put in a complaint to the governor's office, and I've asked for where are these resources? Okay, I happen to be disabled. I can't even get transportation. But mind you, now the transportation companies have a contract with the state of New Jersey to take its constituents for their medical appointments. Can we get that service?
Lisa,
No.
yeah, Lisa, are you in touch with your Center for Independent Living or your ADRC, your Aging Disability Resource
Center
Center?
for Independent Living. Yeah, their resources, they don't have any resources. So then
Okay, you
I
talk to the
asked even the
ADRC.
governor's office, where can we as regular people just find the resources?
Yeah,
Is
the
there a website?
ADRC,
Is there a
the
phone number?
Aging Disability Resource Center. I'll put it in the chat.
Okay. Fortunately, all that stuff isn't working in the state of New Jersey. I know you guys have it and it's supposed to be available and it's supposed to be working, but it isn't. I can tell you, it is not. It's a facade. It's there. They say it's there, but it's not working. When you go to try to call the number, it's not working.
I think, Lisa, you're bringing up a really good point, and I
Yeah.
think there may be others who are experiencing something very similar regarding. I think we've heard from our volunteers that there's so many, whether it's health systems or maybe even insurance, giving the notion that they're going to provide some sort of support for patients if they say that they need either financial assistance or help, but they ask the question, they're screened for it, and then there's no follow through. And so does that do more harm than good? And I think these types of discussions are really important to have because it helps us understand that these systems are far from perfect. we have a long way to go. And I think there was a question regarding our timeline about needs navigation. And, when we started having these conversations about needs navigation 4 or 5 years ago, the landscape looked very different. And now we're starting to see that a lot of the backbone of what makes up needs navigation are under threat right now. And people are even afraid to go out and get that help. And so I think it's really, really some food for thought for us to be thinking about how we overcome this. And I think I saw a comment in the chat about how do we reconstruct these programs? When things burn down, it's a great time to be able to reconstruct. And so I think it's helpful for us to think about how we can do that. And maybe it's having conversations like this with people in your community who may not even know that there are people out here who are trying to solve these issues. And the more people have these conversations, the more that we can demand that our leaders are people who are in positions of power, even if it's just health systems, they can do better to meet the needs of our communities.
Melissa, I just wanted to mention too, I think one of the things we did not address is disparities. I spend most of my days getting calls from people asking for help and trying to get them the resources they need. The most recent one was a Medicaid case where the person just needed a cap on a tooth, and Medicaid denied it. And they basically, when they tried to appeal, they said, just pull the tooth. Well, would they say that to anybody else? No, they would not. So, these are the kinds of systemic barriers that we're up against as well.
Lauren, thank you so much for sharing that. You're right. It wouldn't happen anywhere else, that disparity that you're talking about. What other questions or comments do folks have that we can help with? Go ahead.
Okay, yes, I just wanted to share one situation about the insurance coverage. That what I thought is a crack in the government system. So there was a patient, a cancer patient, who was disabled and then got into remission. So she's self-employed. She had her medical coverage through the marketplace. And then when she found, when she got disability, she got her Medicare A and B. And she was on that for a few years. And then she went into remission. And they took that Part B away. And she wanted to go back to the marketplace for the health insurance coverage because she doesn't have Medicare Part D anymore. So she was not eligible for any sort of government supported insurance, because if someone gets to Medicare Part B once, they can't get away from Part A. So in Part A prevents people to get marketplace insurance. So that is something that I learned, and unfortunately, I could not find any. I contacted agents. They said only through removing Part A. Social Security says it's impossible.
Have you
So
tried SHIP counselors?
What is that?
SHIP counselors, state health insurance program counselors?
Yeah, those agents were one of those. Yes.
Okay, because
Yeah.
they usually have all the answers.
Yes. Yeah, I went to them. Yes, because I could not believe that it could happen, because she is a cancer survivor. So yes, she was like 63 years old. She said, I hope nothing happens to me because I'm staying without the health coverage. So, and that was really upsetting to me, because she can't even go to see a doctor because it's going to be like a cost, like $700 cost or whatever. Yeah, it's a I mean, that is something that I think was not thought through for sure.
I want
Here, thank. Oh, go
sorry,
ahead, Anita. Go ahead.
I want to highlight. Michelle wrote a question. What we think is wise question. Is it saying is needs navigation services for all individuals, even with private insurance, or is it just to provide support to people with Medicare or Medicaid coverage? So to clarify, needs navigation is a concept of services that it should be done for anyone and everyone, regardless of your insurance coverage. And let's face it, not everyone qualifies for Medicare or Medicaid. Example, I have TRICARE, but if I were to get a diagnosis and need to stop working, whatever it may be, the childcare for my children, like are cost concerns. So really what needs navigation is ensuring that everyone gets the resources that they need when they need it. And if their community doesn't have it, well, why is it? Is it that it's called something different that they didn't realize? Or to answer the question that someone said earlier is how do we advocate for this when there's budget cuts? And I will say just having the conversation is what's making people realize what these budget cut means. In my last webinar on Medicaid, like people didn't realize they were on Medicaid. So even having that conversation of, well, funding was cut to this community resource, people don't realize what that means until they need it. And unfortunately, sometimes people don't realize what it meant when it was cut until they actually need it, or that's what that is called in their community. So right now, where we're at is when the question is, well, how do we even do this if it's being cut? Having that conversation, sparking that conversation, letting people know of, hey, do we even have these resources? And if we do, where are they? And if not, kind of what someone said here, she's like, we don't even get those resources. Well, that's the other layer we should say is, well, why? Why isn't that the community are getting these resources? So to the point of it, it's kind of like being an investigator, is investigating why is this happening, or even putting that little spark in someone's like, oh, you know what? That's right. We don't have this community resource. Or where is it? Or even if you don't need it, finding out where it is, because when you have conversations with someone and you're at a book club and you talk about your families and you hear a friend say that they're struggling with someone, you could say, oh, I know this resource. So you can also help them navigate them and let them know what it is as well. Um, and really what it is when you see these policies, understand how that's going to affect your community.
And Anita, I think just want to that end, I think Jackie put a great comment in the chat. We may need to band together and pool our resources in our communities and states with volunteer healthcare staff, agencies, funding from donors, retired nurses, doctors. I think like so many of the people who are on this call, people who don't want to let these programs get burned, people who want to make sure no one falls through the cracks. I think there's value in organizing, really lifting up the resources that are there, providing that central location for everybody so that they know where to get the help. And maybe there can be like even independent people who can verify yet, yes, these are the resources that are reliable, that can get you the support that you need. Um, and I think there's some value in going looking into the community. I think, Anita, you've asked so many questions during this webinar about just having us look into each of our communities to see how are people finding these resources? Are people learning where they can, or do people know where they can go? And I think even just starting with those types of conversations may just lead to more people organizing. So I think that's a really, really valuable point. And Anita, I think there's a great question here for you. And I think I kind of get where Dorothy's coming from. Very basic question here. How did this fragmentation occur? And why do we have to be the investigators?
Because like our healthcare, we're the ones who should be steering that. And instead of saying like, oh, we all are in these webinars, we're all in these same rooms, we all say the same thing of, well, why is this happening? And sometimes we have to take control of it, and we have to be the investigators and to make those connections. Why is it fragmented? Because of what's happening. People don't know how it's being affected. When I look at my community, I live in Smithfield, Virginia. It's a small town, and when we talked about needs navigation, talked about webinars, and even when I shared earlier about the bus stop situation, even looking at transportation if somewhere were to need it, if my cars were break down, even taking my son to the daycare, I wouldn't even do that. It's not. I don't live in a in a walkable town at all, and so how did this happen? It's because no, I don't want to say anyone cared because that's not it. It's possibly because people don't know this is what the community needs because we don't band together. It is our responsibility to band together. It's our coalition. It is our duty. It is our civic duty. In all honesty, it's our duty to do this.
And Sue, I think I see your comment in the chat. And Sue, would you mind coming off mute and maybe sharing a little bit more of your perspective? She might not be able to, but she indicated we have to because we are the ones sitting in the trenches. We have to be the voice. And I know there are times, especially when we've talked about as patients, why are patients having to be the ones that learn the words that doctors are using to just have that conversation with doctors to get the answers that they need? And I think the flip side here is like, well, why is it that we have to take control of this situation? And I think it's because we know we're the ones who are seeing the issues first and foremost. And I think we can use our experiences to help hold those leaders, those people who are in positions of power, accountable. And I do think this is the beginning of movement that's really led by patients and the patient community and those who, as Sue mentioned, those who are in the trenches and really see what this is like firsthand. All right. And I think, Cynthia, you have a great question there. How can NPAF do this? Editorials, that's certainly one way to do it. This toolkit that we put together is really just starting from the very, very basics. As Anita was putting a lot of this information using stories from new volunteers that we've onboarded. Many people just didn't have that experience initially of just like how to have these conversations, where to even start. And so for some who have been doing this for many years, this toolkit may not really be for you because it might seem a bit more, for lack of a better word, elementary. But we do intend to build on that to get to those editorials, to get to tools with organizing and with connecting with your community, and seeing how that all comes together. But yeah, Cynthia, jump in.
So, okay, so editorials might not be the right method of communicating just because a lot of people are they're burnt out on reading the news.
Yeah.
Are there talk shows where you could be interviewed, or if you could get on Fox News, for example, to talk about what people need to be doing and or some of the other talk show people. This is such a huge issue for so many people, and they don't understand why and how it's gotten to where we are, and they don't know where it's going either. And I think that we really need to start educating people.
Yeah.
And you're not wrong, Cynthia. That is certainly one tactic. What we wanted to do here today was to provide so many of you who are in you have your own reach in your communities, whether it's like where you live or your reach online. You all have your own reach, and we wanted to provide the resources. So yes, you all can communicate this with the people you know. And why in an ideal world it would be great to have something like needs navigation, but we can't have that unless we have these programs, these essential programs, intact. And so I think those are the conversations that we really want to make sure that we hear more about. And I think Anita has a great sort of tie-in with what she has done in her own community about talking with needs navigation. And I think, Anita, you can go ahead and transition to that.
So I'm just going to share in on the chat an image. It's last slide, and what it is a thank you to Nancy at Ringo's Donuts. I go to this little, it's a mom and pop donut shop, my way to drop off my kids to sports, daycare, whatever it is, and it's kind of my pick me up, my weekly pick me up. And Nancy always asks, like, it's that friendly face behind the counter in the donut shop and talks and knows a community. And I actually have it even on my calendar, the days that they're closed because they're going on vacation. So I just mentally prepare, am I getting a donut that day? And one day she asked, like, oh, how's work or what are you doing? And I was talking to her about even when I was working with the Medicaid webinar. And then we started talking about needs navigation. And then the following week I came in and she says, hey, that word that you told me, what is it again? I was talking to it about with my daughter and like the work that you're doing. And I'm like, oh, it's needs navigation. And we talked it through. And in fact, not only does she help me with the toolkit, I practiced it on her. She helped me review it. I'm like, is this something that's understandable for the community? Because so many times we see these toolkits and it is at a much different level, and I wanted it to be easy for anyone to understand. And we went through and she said it absolutely is. And in another way we look at it is, and she said something to me that stood out. And she says, Anita, I asked her how she was doing one day, or asked her every day. And she says, Anita, sometimes working here in the donut shop, it's like being a bartender. She's like, people share their lives. They're good, they're bad, everything all around. And she says, another time she learned she had a car that's 25 years old, and she was talking about how much in our town we have to pay town taxes on our vehicles, and she was happened to be talking about it with a local elected official, and he said, Nancy, your car is over 20 years old. You can actually pay a reduced rate, and you just have to fill out this application, and she had to fax it, and she didn't know that. And even that need, it's not a healthcare need, but it was a resource and a community resource that the town provides for people with cars that are a certain age. And she didn't know about it. But by her talking about it with someone, they connected to her. And even she said, she's like, we're in 2025, and I had to fax that. There's no other way to do it. And so with the heart, it's like I have to give a shout out to Nancy and Ringo's Donuts in Smithfield, because that is how I shared needs navigation. That's how I shared even any webinar I have. And I know that she shared needs navigation and why we need in our community with everyone who, sparking that conversation. And so even when you saw on the stages to make these changes happen and to go back to why do we need to do this is, and I'm going to go even right back to the talk show. Our CEO, Dr. Alan Balch, has been on talk shows, on morning talk shows, and he does talk about the work that we're doing and needs navigation, and he directs them to our website. But honestly, the ones that need to bring this in are the people that need it in their communities. So when voting happens, when policy comes up, we know what we're talking about. We know how it's affecting us, instead of, oh, that's nice that I want that. But now how do I make that want an essential part of our care, a standard part of our care?
I know we have just a couple minutes left. Anita, would you mind sharing just the QR code to get the toolkit one more time? And we just wanted to just acknowledge again just this really rich discussion that we had today, all of the comments and questions that came through in the chat. I think so many folks like to refer to the discussion that was had, so we'll be sure to share elements of the discussion. So you all have, I'm sorry, elements of the chat. So you have that to refer to, as well as a recording of this webinar. And we'll also share a direct link so that you can have access to the toolkit. And we also would love to hear your feedback about it. As Anita mentioned, we do have our office hours scheduled for next week, and we really want to use that time to dig a little bit deeper. Are the resources meeting what you all are needing for your community to connect with your community? And is there anything else that's missing that we ought to create and that we can create with you? I think that's one of the things that we really, really find to be exciting to do, to build these resources together with you, informed by the conversations that you all are having and by the connections that you're making. And then hopefully our game plan is to keep building on what we're doing here. I think there's some really, really great ideas that have been shared already. And I'm also sensing this this shift of just in the last year of just being scared about what's going to happen to these essential supports and programs that patients and caregivers and families rely on. That's a very real reality for a lot of us. And I'm hoping that these resources that we've created can just be this sliver of hope that we can get through this and that we can, maybe just start educating one person at a time. If I think at one point I saw that there were 100 people on this call. If you all talk to just one other person, just think about that reach and that domino effect that can happen. And we would love to come back and have this conversation just to see, all right, this is where we were in August 2025. Let's see how we've moved the needle just in a couple of months. So with that, I know we're at time, but really thank all of you for taking the time today to be here. Anita, do you have any other final words you want to share?
Yes, once again, thank you all for being here. Thank you, Nancy and Ringo's Donuts. And like I said, I'm going to pre-thank you because I know you all are all going to go to your communities and share this. So thank you already for doing that. And obviously, we want your feedback, even other resources that you think that we should add, or even your experiences. Hey, this was my experience, it didn't work, or I want to hear it all, good, bad, and even how to suggest new things. Thank you all.